But our top story tonight, and it is the focus on COVID, but this time it is the post-COVID complications that are affecting more and more people in India and across the world. Now, with over 38 million cases worldwide, the coronavirus infection has spread across populations. Each day, top medical experts are unearthing new patterns in the SARS-CoV-2 virus. Now, with over 28 million patients recovering from the disease globally, scientists and doctors have found significant evidence that the virus can continue to wreak havoc on the human body even after the infection. Today, we are going to speak to some of the country's top doctors. Why is it that even post-COVID, there could be infections of heart and lung in particular that you should be worried about? Before that, take a look at this report decoding what's now being called the post-COVID syndrome. It's our top story.
More than 3 months after Ramakrishna recovered from COVID-19, his body continues to battle the damage caused by the virus.
जिंदगी बहुत बदल चुकी है, उतना एक्टिवनेस कभी लगता नहीं.
More than 10 months after the SARS-CoV-2 virus appeared on the global radar, COVID-19 disease still remains a mystery in many ways. Experts knew COVID-19 was a respiratory illness from which most people recover within 2 to 3 weeks. But new medical data suggests the virus leaves a deadlier trail within the infected body, and the damage may continue even after the patient tests negative. Although the most virulent manifestation of COVID-19 is limited to the respiratory system, primarily the lungs, many worldwide reports have now demonstrated lasting organ damage in recovered patients. Studies point out the virus leaves an impact on one's heart, brain, the digestive system, and kidneys. This new phenomenon has been termed as the post-COVID-19 syndrome. An ongoing study conducted by the Medanta Heart Institute in Delhi NCR finds many of the recovered COVID-19 patients present themselves back to hospital with cardiac symptoms. Only 23% patients had past history of cardiovascular disease prior to COVID-19 infection. Some cases of inflammation of the kidneys and the brain has also been recorded. For Ramakrishna, life post-COVID has been hard, even after the young Mumbai businessman and his family recovered from the disease.
आफ्टर रिकवरी के बाद जो भी कम करता तो इतना आते थे कि ये पूरा खाली होता था और फिर पीछे का पूरा खाली हो गया और उसमें इवन मेरे घर वाले को भी वही प्रॉब्लम हो गया था. कंसंट्रेशन लेवल बहुत कम हो गया था क्योंकि जब कोई चीज आगे मैं कंसंट्रेट कर रहा हूँ तो फटक से मेरा सर दुखना या फिर आइस में प्रेशर आना वो सब चल ही रहा था.
Both Ramakrishna and his mother have complained of intense forgetfulness or brain fog, one of the most common symptoms being faced by COVID recovery cases.
A 47-year-old lady from Palghar had come to us with altered sensorium, and on evaluation we found her to be COVID positive, and now that we observe her, she has forgotten those 7 days of hospitalization, but she is able to carry out her activities on her own. However, there are few memory lapses and lack of concentration, which is suggestive of brain fog.
Doctors believe many of the symptoms, especially fatigue, may be a continuation of the recovery process post-COVID-19. But what is clear is that there is a lot yet to be known and understood about the SARS-CoV-2 virus.
So tonight we are coming up with a doctors roundtable. 3 of the country's top doctors are joining us to try and understand the various concerns that now afflict COVID patients. I'm joined by Dr. Randeep Guleria, the All India Institute of Medical Sciences Director, Dr. Naresh Trehan, Chairman Medanta, and for a perspective from Mumbai, Dr. Hemant Thakkar, consultant physician, one of Mumbai's leading physicians. Appreciate all of you joining us. We're going to go concern by concern, gentlemen. I want to come to you, Dr. Guleria, on the first concern, which is these post-COVID complications, pneumonia, encephalitis, scarred lungs, neurological problems, even heart problems. How serious are they? We seem to be seeing at least a few cases in every city now where people are experiencing these problems even after recovering from COVID.
So these problems are significant, and we could look at it in a broad way that if you look at the data which is emerging of people who have recovered and have been now 2 months after recovery, the studies from UK suggest that at least 10% of individuals still continue to have symptoms, which is a huge number if you look at it in absolute terms. And there is data from Europe which suggests that in one study, that almost 70 to 80% of individuals continued to have some symptoms even after about 2 months. But in majority of them, these symptoms were mild in the sense of fatigue, body aches, not being able to concentrate, joint pains, and some degree of dry persisting chronic cough. But then there is a small percentage who have long-term damage in various organs, which can actually be very serious. We have what we call lung fibrosis, extensive scarring of the lung. And there are many patients in our study where we've had this problem, and some of them have gone home on oxygen therapy. They have not recovered totally, and they need oxygen at home to really be able to sustain themselves. Similarly, patients have had what we call myocarditis, and they get breathless even on minimal activity. Mm-hmm. And we also know that it can have neurological manifestations, stroke can happen, or you can have other alterations in your neurological function. And like we just heard, brain fog is something that is now being commonly described even in the US, where it's being seen more and more often. So as we move to this phase of the pandemic where we have a large number of recovered patients, we are realizing that this is going to be a major problem in the coming years. And many hospitals, including AIIMS, have now started what is known as a post-COVID clinic to be able to manage these patients not only from their physical problem, but even from the mental problem and the psychological stress that they have in coping with day-to-day life.
Before I go to my other doctor, just want to understand from you, Dr. Guleria, that you're saying lung fibrosis, for example, scarred lungs is a major issue, some neurological problems. Are these of patients who already have those symptoms before they got COVID, or is this a consequence of COVID?
No, this is definitely a consequence of COVID. These are individuals who did not have any underlying respiratory or cardiac disease. They developed COVID infection, COVID pneumonia, or the inflammation that COVID causes, which causes myocarditis, causes increased clotting, or the cytokine storm. Because of all of this, it causes effect on various organs in the body. Mm-hmm. In the lungs, it causes pneumonia, which causes destruction of the lung parenchyma. And when that heals, it heals with scarring, and that part of the lung then cannot take part in gas exchange and therefore cannot be used by the body for extracting oxygen from the air. Similarly, if the muscles of the heart are involved, mm-hmm. then they're not able to pump efficiently, and the pumping function of the heart actually starts suffering. And same happens in areas of the brain where, because of clotting, that part of the brain stops functioning, and these damages are actually irreversible, and therefore they tend to cause major problem in these individuals.
You know, you just mentioned heart. I want to come to Dr. Naresh Trehan on that very point, because Dr. Trehan, you called me up a couple of days ago suggesting that you are now coming across patients who a month after recovering from COVID are either suffering in some cases from a mild heart attack or some kind of heart related symptom, narrowed arteries, heart muscle tissue issues, inability to pump blood, blocked capillaries. So clearly, there are patients today who, even after recovering from COVID, as Dr. Guleria said, still need to be looked at. Are you seeing any pattern?
Most definitely. So we are doing a study right now, and we have 55 patients who are post-COVID recovery. In the recovery phase, we have done very detailed echocardiographic studies on them to see what the muscles are doing, what the ejection fraction is, what is the heart rate, tachycardia, all those things we are recording. And we have found that out of the 55 patients studied so far, there are 10% patients who are showing significant signs of compromise of their myocardium. Mm-hmm. And that looks like inflamed, it is like compromised function in the heart, their inability to exercise. So all these things we have observed, and we are doing a detailed follow-up on these patients. But what is shocking is there have been 3 cases that I know of and we know of from our hospital who have young people who had mild disease. 1 month, 5 weeks, 6 weeks later were exercising and had major heart attacks and collapsed. So obviously what we are seeing in these patients who we are studying, mm-hmm. that the inflammation can happen even in mild patients, and that today we have formed an algorithm of saying what should be the cases who need to be checked for all their organs at what intervals.
And this is
And what
Dr. Trehan. Dr. Trehan, this is a couple of weeks after they have recovered.
Yes, 3 weeks after they have recovered. So now, no, what is even worse is a lot of patients are getting kidney failure after that. The renal failure, we have one patient who was not recovering, and we did a biopsy on his kidneys, and we found the remnant of the virus in them. We sent them for electron microscopy, and we find that the virus is actually present, the remnants of the virus, not live virus. The remnants are present in the entire kidney layers. So basically what we are saying is that the original belief that it only attacks the lungs, and maybe the damage to the other organs is because of the inflammation, it may not be limited to that the virus actually physically attacks different organs because it has been cultured or actually now being cultured. We don't know the results yet, but we are getting them cultured to see if the virus is alive or is it dead virus that was there and now has eliminated. So there are many aspects of it, and like Dr. Guleria was saying, that there are studies from UK. NICOR has just published a study which says that 10% of the patients who have recovered will have, again correlated to our studies, that they will have some sort of cardiac dysfunction.
10%,
So,
that's a fair number. I just press the pause button to go to Dr. Thakkar, because as a physician, you're coming across a lot of patients on a daily basis. Are you seeing any pattern of any post-COVID complications now emerging in particular? Are these patients who've already had certain comorbidities? Are you seeing a pattern, doctor?
So I'd like to divide these post-COVID complications into two groups. The virus affects the organ itself, which is the lung, heart, kidney. And then the virus, through the blood and stimulation of coagulation dysfunction, affects circulation all over the body. So I agree with Dr. Guleria and Dr. Trehan that the organ gets damaged. Now, as far as the lung is concerned, we are seeing people who came in with healthy lungs, had the obvious COVID pneumonia, and because the pneumonia was widespread, as the pneumonia heals, it heals with scarring. And scarring takes away from the elasticity of the lungs. So the lungs cannot expand and contract well, so they cannot diffuse the gases. So they need to go home on lesser and lesser degrees of oxygen. And how much time they will take to recover their elasticity, whether the elasticity will come back fully, we don't know. And we already have cases, I have colleagues overseas, where the line for lung transplant has already piled up. As far as the heart is concerned, we know that every viral infection, whether it is herpes or measles, you can get the heart affected in two ways. One is the heart muscle, myocarditis, which in my opinion, we've had so many patients in Bombay who came in with poor ejection fraction, but they recovered and their ejection fraction came back to reasonably almost normal limits. But coming to Dr. Trehan's example, that was a complication, the heart attack, of the coagulation, the arteries which carry the blood to the heart. And when this patient went on and did his treadmill, he had a heart attack, which is why we give our patients blood thinners, not for 2 weeks, not for 2 months, but some even for 6 months or even for life. So if these people tilt the demand-supply situation on the treadmill, they can get a heart attack. Having said that, I would say every syndrome, neurologic, weakness, kidney, is all because of the post-COVID reaction. Esoteric examples are there where the thyroid can get affected, the pancreas can get affected, but all one needs to do is be vigilant, take the return back to life normally, and keep doing your parameters depending on which organ is involved.
I want to come to specifics. Come to specifics for the treatment, and I want to come to all three of you one by one on that. Dr. Guleria, treatment. You're saying that as you've been saying, and you are India's leading pulmonologist, particularly when it comes to lungs, you've seen the scarring of lungs. Is there treatment that you would advise to patients after they recover? Do you suggest that they come back every 2 weeks to the hospital for a checkup? Do you advise that they be careful with the kind of exercise they do? What do you advise?
So we're already doing that, and what we do is, not besides what is being done in terms of a scan or an X-ray, we do the lung function test also on a regular basis. And what we're doing is not only those patients who are admitted, we're also finding that those individuals who may have had a mild illness and who are in home isolation, and whom we are now contacting and asking them to come and get their lung function done. Some of them will also have features which suggest that there was some scarring in the lung, but they got away without having to have been admitted. So it's important to remember that it's not only in the admitted group of patients, but also in those who may have mild disease and may have been in home isolation. If we start looking at them also, there would be some that would have alteration in the lung.
So what would you recommend, doctor, would you recommend that they do these regular checkups every couple of weeks? What do you recommend, Dr. Guleria?
What we are saying is that it normally takes around 6 to 8 weeks, and we would say that after 2 to 3 months, because sometimes if you test them too early, you will find there is a lot of changes, but they will heal over a period of time, and lung function and their oxygen saturation actually improves. So normally after 2 to 3 months, you get an idea of what is the residual effect which is left. It's important to remember that COVID-19 causes what we call chronic inflammation. It causes inflammation in the lungs, in the vessels, in various organs. This inflammation can persist even after the virus is gone and you have actually recovered clinically.
Right.
And this subclinical inflammation which persists in these organs can continue to cause some degree of a problem, but as it becomes all right over the next few weeks, you may recover. And that's why it's important to assess these patients around 8 to 12 weeks to get an idea of what is the long-term effect that they may have on these organs. What we really advise our patients are basically pulmonary rehabilitation, a gradual exercise that we make them do. It could be done using treadmill or some other exercise, or even yoga in a structured manner can be done so that the lung capacity improves, the respiratory muscle, the diaphragm strength improves, and they're able to gradually improve their oxygen saturation. There are certain drugs also which are being tried, which are known as anti-fibrotic drugs. And in the early stage, we even give steroids for a little longer period of time with the hope that the inflammation which is there will resolve at a faster pace and lead to minimal scarring. But the efficacy of these drugs is still being studied because this is a new phenomena and we are still not sure which drug will actually be the most beneficial.
I think you've made a very important point that even those with mild symptoms need to be careful. Your treatment suggestion, Dr. Trehan, is there a line of treatment that you're suggesting for those who are recovering from post-COVID that they must go through to ensure that they don't get these complications?
So we have divided them into 3 groups. People who have mild symptoms, people who have moderate symptoms requiring oxygen, and severe symptoms who may actually have to go to the ICU. So we treat them, and their protocols have been made in a way that their follow-ups are according to those. So the ones who have been through the ICU, and then they will, before they leave, they'll get a full checkup. They'll get their cardiogram, they'll get echocardiography, their pulmonary function, and sometimes even the HRCT to really assess what we are sending them home with. According to that, most of them will come at 4 weeks for their checkup, and we have what we call cardiopulmonary exercise, which we do, which will tell us the VO2 max, that how are the lungs extracting the oxygen and how well is the blood being oxygenated. So this can be measured in those patients who we consider severe. The ones we consider moderate, they will come at around 6 to 8 weeks, and the mild ones will have to have one checkup at 6 weeks, where, see, in the heart, they can get irregular heartbeat, they can get tachycardia, they can get permanent changes of myocardial damage, and they can show inflammation which is progressively improving. So we need to tailor their rehab therapy according to what damage they have suffered and what they are showing as we go progressive. So what I said to you about somebody, 3 people dropping dead that I know of, that those are the kind of people who we would first check before we release them to go and exercise, that we would test them and then let them go and resume their activity. There are 2 reports from UK where 2 young athletes, one football player and one athlete, 17 and 19-year-old, who dropped dead without any history before. They were post-COVID and they went and played and did strenuous exercise and they dropped dead. So basically what we are saying is, do not think that you had a mild case that you are invulnerable. You're not.
And you're saying that at least for 6 to 8 weeks, both you and Dr. Guleria are saying 6 to 8 weeks is that period that you need to be very careful. I just want to ask you, Dr. Thakkar, the line of treatment, you said using blood thinners is one of the lines of treatment. In terms of medication, are you recommending a particular line of treatment? Today, WHO has said remdesivir is not necessarily the treatment. Dexamethasone being used on a lot of treatment, but that is for COVID. What about post-COVID? What's the treatment you're suggesting?
I think the term chronic inflammation is most important because that is the baby that the patient is lumped with after the marriage, 14-day marriage of COVID is over. And chronic inflammation is to be anticipated. You have to give blood thinners, you have to give tapering, prolonged doses of steroids, and you cannot fall prey to the patient's request, let me do another CT scan next week, let me do blood test next week. You have to phase it out. The chronic inflammation, often people who test too early in their CT scans show 2%, but 20 days later show 20%. So you have to watch for 2 months and do not allow patients to return back to normalcy in the form of exercise and treadmills. 1 month stay at home, then return to only mandatory activity.
Even if you have mild symptoms, doctor? Even if you have mild symptoms?
If you have mild symptoms, I will still keep you at home for 3 weeks, at least, if not more, because the symptoms may be mild. The chronic inflammation in the body can silently continue, and suddenly you can have a problem. So I would give the blood thinners, I would rest you, and I would investigate you if you had mild symptoms after 4 weeks. Make sure all your organs are okay, no albumin in the urine, no shadow in the lungs, no change in the EKG, and then allow you, but not to get onto the treadmill and start playing football or running around for another month at least.
Let me come to the next major concern, and this is referred to briefly by all of you, which is a large number of relatively young people in India are vulnerable, Dr. Guleria. According to the Health Ministry, nearly half of the COVID-19 deaths in India are people less than 60 years of age. Close to 35% are in that 45 to 60 age group. Another 10% in the younger age bracket of 26 to 44. Is that a worry? Is that a concern? Because if you remember right, when we started off sort of looking at COVID, it seemed that the most vulnerable were the aged. But in India, we have a large number of younger people also affected. Is there something that they should be worried about? Is there a pattern you detect?
So that's true. We need to be careful, and it's very important that the younger people realize that they are not sort of protected, and it's not that they will get a mild illness. We must also understand that a large number of comorbidities occur in India at a very early age. Diabetes occurs 10 years earlier than what's been reported in the West. Coronary artery disease or heart diseases also occur much more earlier in India as compared to the Western population. So a lot of comorbidities occur at a relatively younger age, and these comorbidities also are a risk factor for having more severe disease. So I think that's important to keep in mind. There are certain other comorbidities that we are finding are more unique to our country, which are not being reported. We've looked at our data and found that even having tuberculosis in the past or having scarring in the lung because of what we call post-tubercular sequelae also leads to more severe disease. And therefore, there are certain comorbidities which are unique to the developing world in terms of chronic infection, past recurrent pneumonias, which also happen in a younger age group because of, say, childhood pneumonias or childhood illnesses, low socioeconomic status predisposing to a lower immunity. A lot of these factors also predispose to more severe disease, which are actually not that well reported in the Western literature. So we need to be very vigilant even in the younger age group.
Dr. Trehan, you want to add to that? Are you finding a pattern where a number of people in that 45 to 60 age group are particularly vulnerable at the moment?
So let's put it behind us that we now know how to treat COVID syndrome or in the COVID period, the infection period. We know sequentially what to do. And it's the good thing about India is that most doctors know that now. The medicines are available. Our mortality rate is much less than some of the countries in the Western world. So that is now settled. what we are experiencing now is the fact that there was a myth that younger people will get milder disease, so they don't have to worry. That's not true. You just said the statistic yourself. And there are two, it's a double whammy. One, they are not safe if they get it. Second, if they get it and they even have milder symptoms or they don't know, they will go and infect their family members who may be elder members in the family or having comorbidities. So that's the second warning. So do not let your guard down just because you're young and you can go and socialize, because that's where it's spreading right now. And I think that's what's happened in the Western world, and that's happening in India now, that the younger people have got fed up. They are now going out and socializing and spreading it again. We are experiencing it in all the patients that we are getting, that it started from somewhere in their family and not direct exposure to the elderly. That is one. The second is, as we said already, we know that you have to exercise caution in the post-COVID period, especially if you have comorbidities. So we know that patients who have cardiac disease before, they need to be observed even more aggressively and treated more aggressively. So it is said now that there are more deaths at home today from cardiac disease than in the hospital, because patients who were ordinarily coming for their treatment to the hospitals because of the fear of going out to hospitals has caused many, many, many deaths. There is exact data from UK which tells you that 20% more deaths happened at home than in the hospital. So I would say today, most hospitals have got separated their COVID sections from the non-COVID sections. It is reasonably quite safe to go and get yourself treated if you have a disease, especially if you have diseases like cardiac or other surgical treatment that you need. Do not delay it, because a lot of damage is being done by just not going for treatment.
Okay,
so these are the three things to be kept in mind. And follow up yourself in one of the hospitals or wherever there is a good rehab program, post-COVID rehab program and clinic. I think you should be checked out at least once, no matter if you were minor, mild or moderate.
Let me come to another interesting fact that I've just found out, Dr. Thakkar, because studies in Denmark and Canada seem to suggest that the likelihood of your COVID-19 condition and how well you recover also depends on your blood group. They seem to suggest that those who are in A and AB groups are at a higher risk than those who are O. Is that true? Do you see any connection at all?
This is an epidemiological survey where they have randomly taken all the patients and they have found that people with O had lesser afflictions of the organs as compared to those with ABO. The precautions as far as we physicians are concerned are universally the same. You have to anticipate the problem. The problem in India is, since diabetes and hypertension begins at 30 and 35, when the 40-year-old man gets COVID, he doesn't even know he has diabetes. He doesn't even know he has hypertension. So at that time, we are fighting a triple whammy. His uncontrolled sugars, his uncontrolled heart condition, and now COVID. So which is why the balance of treatment is a little difficult. If you have a 60, 65-year-old man who is already taking blood thinners, statins, antihypertensives, ACE inhibitors and everything for his condition, he has already found and formed a base for himself. So he then only needs tweaking of his medicines and treatment for COVID. The younger man needs everything afresh, which makes him more vulnerable. You could be saying that your genetics are good and you have O blood group as against ABO, but that cannot make you drop your guard. You have to be alert. Look out for general medical awareness. I'm sure COVID will open the eyes of the health authorities in our country that now, after COVID, post-COVID, everybody will tweak up and look into their medical conditions to anticipate issues rather than to treat them when you meet them.
Can I come to you, Dr. Guleria, on the other concern that maybe, as we are seeing in Europe at the moment, we could be entering a potential second wave. The festive season is upon us. Winter is coming. We are seeing in North India, certainly pollution levels drop once again. That usually affects lungs and, leads to respiratory problems. Is that a concern? And therefore, how should one deal with this? Is this going to be a period when, over the next 2 months in particular, one needs to be extra careful?
That's true. If you look at what's going to happen and what's happening in Europe, it's a cause of concern. And that's basically because of the three factors that you mentioned. One is because of the festive season, there's a very high chance that people may start crowding, or there will be crowds and there will be no physical distance, there will be no masks. And if that happens, these can become what we call super spreading events. The second is that we know viruses tend to survive for a longer period of time in the air, in the cold weather. And also because of cold, people tend to crowd more inside the house and where there is very poor ventilation. And therefore, the chances of infection spreading from one person to the other are much higher. Thirdly, there is also data now, which is also there from data from Italy and from China, which has shown that there is a direct link between increasing number of cases and severity of COVID-19 and air pollution. As your PM 2.5 rises, the number of cases of COVID have also been shown to rise significantly. And like you said, air pollution also leads to inflammation in the airways, in the lungs. And then this, along with the COVID infection, can have a much serious consequences as far as the lung or the COVID infection is concerned. Therefore, what I feel is that the next few months in India are crucial. We need to really have very aggressive COVID appropriate behavior. We need to have people understand why it's so important, and they just need to see what's happening in Europe or in UK to understand that unless we do something in terms of preventing this spread, we will have a huge increase in the number of cases during the coming months. So it's very important that we understand our responsibility, young and old, in terms of physical distancing, wearing a mask, and hand washing. I know there is a lot of COVID fatigue which has set in, and now people seem to be fed up, but we have to find ways to re-energize them, to make them understand the importance for the next few weeks or months.
Are you seeing, Dr. Thakkar, in Mumbai any pattern? Delhi, of course, pollution levels, as I said, have fallen sharply. But are you seeing any pattern of the kind of patients that you're getting now, 6-7 months after COVID first hit? Is there any signs of a second wave?
Well, we probably were or still are recovering from the second wave, because we saw a big spike in September, which is now plateauing out. But I am also very scared about and apprehensive about the oncoming months, because in Bombay, which is still facing a little bit of monsoon, we'll have humidity, we'll have pollution-induced problems, and cough and cold is the order of the day during these next 2 months.
And you've got the festivities. The Navratras have started today, and the worry is that you'll have large gatherings.
So that, of course, has to be a no-no. The cracker smoke has to be a no-no. I think 2020, like I have always said, is protect your life. The festivals will come next year also. So this message has to be put loud and clear, that do not enter these festival gatherings. Keep your distancing. And if you're prone to cough and cold during October, November, December, take your prophylactic inhalers, your antihistamines, even your local homemade remedies. But keep the cold away from the throat, because the throat is the entry of the virus. And if you get these symptoms, the virus will quickly get in and you will be worse off. So these are the months that you have to have extra antennae, and your blinkers should be on to pick up symptoms and prevent them.
Dr. Trehan, do you believe that this is a year particularly where people need to therefore take that step back? That, there is a feeling that COVID fatigue has set in. That people are saying, yaar, 6 mahine to hum lockdown mein the, now we need to, festive season is coming, let's go out, celebrate. We want to get back on trains, we want to go back to office. Would you advise also restraint?
That there is no such thing as letting your guard down, but that there is such a thing as unlocking sequentially. So the point is, if you wear a mask and you keep your distance and do hand sanitization, you can go out. If you go and meet 4 to 6 people at a distance from each other, and you need to meet because you need that social contact, it's okay. But you should not be eating on a table with your mask down, 6 people together. Then if even one of them has it, then all 5 of you will get, the other 5 will get affected. So the point is to exercise intelligence, conscious of the fact that the virus is a deadly virus, and the fact that you can protect yourself by masking and distancing. So if you keep all those factors in mind all the time, you may be able to...
No, so do I go to a social gathering or not? Do I go to that social gathering of 6 people where we will have the best of Diwali food or not?
Not unprotected.
Okay.
You should be out there, and especially if you're going to meet people in the open, it's better. And you can maintain the distance better, and the virus doesn't have a closed space to circulate.
Okay,
so
you're wary of people in closed spaces, in a sense, having big gatherings. Dr. Guleria, any other final word of caution for people at a moment like this? As I said, you know, there seems to be a COVID fatigue, so people seem more willing to take a few chances, in a sense, by socializing much more as festive season approaches. What's your word of final advice for them?
So I think we need to be very, very cautious. We aren't out of the woods. And currently, whatever we have in terms of a vaccine is the physical distancing, wearing a mask, and hand sanitization. If we do this sincerely, and there is data which shows this, that if everyone was to do this sincerely, we could drop our number of cases by almost 40%. So just by doing these 3 measures, and this has been shown in various countries in Southeast Asia, we haven't seen a spike of cases in Taiwan, in Vietnam, in Singapore, because they've been able to follow these simple norms in a very aggressive manner, and you have life almost back to normal in these areas just because they've been able to follow this. If you are able to do this, we will be able to actually go through the winter months without having an increase in number of cases. We may even have a decrease in number of cases. And that is why we need to aggressively work on making people understand that despite so many months, despite the fact that you've been in lockdown for a long period of time, you need to just sustain it for some more time, and we shall come out of the woods without much mortality.
Let me get the physician the final word. Dr. Thakkar, there are those who are... I'm being advised by my doctor to have my zinc tablets and vitamin C. Is that enough? Is there something you would recommend for the next month or 2 that one needs to take as a precaution?
Mr. Sardesai, we are 4 months away only from celebrating the COVID birthday. Be careful. The vaccine is coming closer. Keep your guard fully up. All the social measures, your occasional zinc twice a week, some vitamins. Most important, eat healthy, be safe, sleep well.
So are you saying zinc twice a week or zinc every day?
Well, we are now seeing that zinc every day has piled up so much into the system that we are finding people with extra zinc in their bodies. So if you took zinc 2 or 3 times a week, it should be enough. Vitamin C in large doses is not recommended every day. You can intersperse it to alternate day or 3 times a week. But what is most important is be safe. Distance yourself, go out in the open and meet people so that the virus is diluted in the atmosphere. Wear a proper mask which covers the nose and the mouth and not around the chin only. And wash your hands. If the winter months go by, we would have 1 year of COVID education. The vaccine will come closer. We will get wiser, and we shall be definitely able to overcome this menace.
You know, I want to say this, that it's very rare that I get 3 of the country's doctors coming and speaking with such erudition and explaining what's happened in terms of post-COVID complications. So it's been a privilege listening to you all. Someone on Twitter has said it's a bit like Gavaskar playing the cover drive to listen to these 3 doctors. All 3 of you have played the cover drive quite superbly today. So Dr. Guleria, Dr. Trehan, Dr. Thakkar, thank you so much for what has been a very educative experience for me, and I'm sure for many of our viewers. Stay safe, stay well. It's not over yet, is the clear message. Don't let your guard down. Thank you all very much for joining me here this evening. Let's take a break at this point.